Hello, my dear friends. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it.
Today, we'll take a closer look at the thyroid cartilage, how it's shaped, what muscles and ligaments are attached to it, and how each of them contributes to its movements.
So let's now begin study of thyroid cartilage. So let's ask ourselves, where is this thyroid cartilage? Yes, you can palpate it. I can palpate my thyroid cartilage. Boys can find their thyroid cartilage so much easily because it protrudes out in the form of an Adam's apple, right? So this is your thyroid cartilage extending over C4, C5 vertebrae. And now I want you to understand the shape by doing the same thing that we did for epiglottis, paper cutting. So this is a sheet of paper. I am going to fold it, not lengthwise, I'm going to fold it widthwise. Now, I'm going to draw a thyroid cartilage on it. Again, drawing thyroid cartilage is not difficult, but it's not exactly easy. So my suggestion would be use the PDF that I've given you. However, if you're smart and you're good at drawing, then my suggestion is, come, let's draw. Okay. Remember, this is the shape and I've drawn the shape for you. Okay. This is the shape that I want you to draw. This is 1/2 of thyroid cartilage that you're going to see. So remember, hold the paper in this manner, not like this. Hold it at an angle. Okay. It's just a marker for me. Okay. So hold it at an angle. Draw the thyroid cartilage as shown here. Okay. Take your scissor and begin to cut it out. Okay. Come. Cut it out. Right. So that completes our thyroid cartilage. Remember, it's a folded sheet. So it's going to open out to become like this, the pretty little butterfly. Okay. So this is the thyroid cartilage that you must have in your hand to be able to really understand the topic of thyroid cartilage. It's okay if you have an amazing imagination. Maybe I don't have a great imagination. I like having a thyroid cartilage in my hand, okay, when I'm teaching as well as when I'm learning, okay. Just a second. Remember, we've also cut out the epiglottis, okay. Take the epiglottis and stick it in. Okay, does that show you the lateral view, the beautiful lateral view of larynx? Okay, all you have to do is imagine a hyoid bone here and there you have a paper cutout of your larynx. Okay, so now let's keep the epiglottis away. Use our thyroid to study the thyroid cartilage. Come. So if you're liking my lectures, do like and subscribe to my channel. So let's study it. So this is the thyroid cartilage in your hand. Please use that for understanding. I'm going to use the screen to explain. Here I can see the thyroid cartilage. As you can see, it has two laminae, a right lamina and a left lamina. Okay, so hold it like this, right lamina, left lamina. It has an anterior border where the two laminae meet. It has a portion of it which projects. See, remember, it has a part that's going to project forwards here. This anterior projection is called the Adam's apple and is about 90 degrees in the male and 120 degrees in the female. It's there. That is the reason why we females have a rounded neck, whereas men have a very pointy neck. Not that we are complaining, everything is fine. Okay, but that's the way it is. And here is the posterior free edge here, which rises up as the upper horn and rises and descends down as the lower horn. So superior horn, inferior horn. And on the side, the thyroid cartilage has an oblique line. So our model does not have. So take a pencil and draw the oblique line. What is stopping you? So I'm going to draw an oblique line here and I'm going to draw an oblique line here. That's my oblique line. Right. So now, if you look carefully, the lamina of thyroid cartilage is almost a quadrangle. Okay, it has a superior border, inferior border, upper border, lower border, anterior border. At the anterior border, you can see how the two laminae meet. Upper border, lower border. Anterior border, a border where the two laminae meet and fuse. And a free posterior border, outer surface and inner surface. For each lamina, I'm going to have to study these parts. Upper border, lower border, anterior border, posterior border, outer lamina, inner lamina, or outer surface, inner surface. Clear? Come. So now, this is the hyoid bone, this is the thyroid cartilage, and this here is the upper border. So what do we know about it? I don't want to teach you. You should know that the upper border is attached to the hyoid bone by a thyrohyoid membrane. And the thyroid membrane thickens laterally to form the lateral thyroid ligament and anteriorly in the midline to form the median thyroid ligament. So clear superior border being acting as an anchorage, anchoring the larynx to the hyoid bone. Now this is the lower border. Okay, as you can see, the lower border is initially quite straight and later on forms this little curve as it continues down to form the inferior horn. This lower border anteriorly gives attachment to the conus elasticus. We've done this ligament earlier. But the rest of the lower border gives attachment to this beautiful muscle, the cricothyroid. What do you know? Just ask yourself. Cricothyroid. From what to what? From cricoid cartilage to thyroid cartilage. Very simple, somewhat obliquely placed muscle. From cricoid anteriorly to thyroid a little more posteriorly. So what is cricothyroid muscle? A muscle that takes origin from cricoid cartilage, with the fibers directed upwards and backwards, inserted into the lower border of thyroid cartilage. Very easy, right? So we ask ourselves, how does this act? How does it act? Okay, that's what it's all about, right? So remember, this muscle is called as the tuning fork of larynx. Why? Because, let's take a look. Now, this is a diagram which is the thyroid cartilage part of it is quite familiar to you. Rest of it is a little bit of difficulty. So, let's understand. This is your adenoid cartilage posteriorly, attached with the help of a vocal ligament to the thyroid cartilage. See here, this is your thyroid cartilage. To this posterior surface of thyroid cartilage, the arytenoid gets attached with the help of a vocal ligament that you're seeing on the screen. Now, this is your cricothyroid. When it contracts, what it does is, see, this is your thyroid cartilage. Okay, cricothyroid is attached to it here. When it contracts, it just pulls your thyroid forward. This is your thyroid, it just pulls it, tilts it forward in this manner. Please practice that. Okay, it's here, it's getting tilted forwards here. When it tilts forward, rest of the cartilages remain in their place. Arytenoid remains in its place. Okay, so your thyroid cartilage has moved forward. Now, the vocal ligament, therefore, is stretched. Posteriorly, the arytenoid cartilage refused to move. I will not move. I will stay in place. So, the thyroid, which has moved forwards, therefore results in a stretching of the vocal ligament. Okay? I don't know how many of you have played a guitar, but you need to have the string stretched to be able to create correct sound, isn't it? So, now our vocal ligament has got nicely stretched. And when you speak, you are able to produce the right kind of sound. That is why we say that our cricothyroid muscle is the tuning fork of larynx. When it contracts, it pulls the vocal ligament, which is responsible for production of variable types of sound. Okay, so the result of contraction of cricothyroid is increasing the distance between the arytenoid here and the posterior surface of thyroid cartilage, resulting in tension of the vocal cords and vocal ligament, which is the content of vocal cord. Okay, that's how your cricothyroid contracts, and that's how it acts as a tuning fork of your larynx. Right. So we've studied cricothyroid muscle. Let's talk about now the anterior border. This is the anterior border of larynx. Okay. When I open the larynx, this is the posterior surface. This is the posterior surface of the anterior border, isn't it? This is the anterior part of anterior border which you can actually palpate. And this is the posterior part of the anterior border which is facing inside the lumen of larynx. Okay. If you look at the diagram here, you find that there are a lot of structures attached on that posterior part of the anterior border. Okay. First ligament is very familiar. It's where the epiglottis comes and gets attached. So it's the attachment of thyroepiglottic ligament. For one last time, I'm going to show you again. This is your epiglottis. This is how it's related to your thyroid cartilage. If you look carefully, here the epiglottis is attached to your thyroid cartilage. Is that clear? So this is where your epiglottis is getting attached to the thyroid cartilage with the help of which ligament? Thyroepiglottic ligament. Okay. Below that, you can see two little attachments, a pair of attachments above and a pair of attachments below. This is vestibular ligament. All right, I have a question for you. What is vestibular ligament? We've just done that. Remember, the lower free edge of the quadrate membrane thickens to form the vestibular ligament. You have to repeat this. Okay, remember, larynx is about going back and going forward. You can't say I've studied it. You have to go back and check. Vestibular ligament is the lower free edge, thickened edge of the quadrate membrane. What was quadrate membrane? It was a membrane that entered into the thyroepiglottic fold, giving it support. So these are the two vestibular ligaments of both sides, and below that these are the two vocal ligaments of both sides. Now what do I know about vocal ligament? Vocal ligament is a ligament within the vocal cord. Every time my cricothyroid contracts, the vocal ligament gets stretched. That much I have learnt in the last 1.5 lecture. Besides the vocal ligament, you can see 3 muscles being attached. They are from medial to lateral: Vocalis, Thyroarytenoideus, and Thyroepiglotticus. Why have I put a tick mark for Thyroepiglotticus? Yes, I've put a tick mark because we've already studied it. That means which 2 muscles do we want to study? We want to study Vocalis and Thyroarytenoideus. Come. Now this is a transverse section through the larynx. Please orient yourself. Okay. Anteriorly this big. So this is what you're looking at, something like this. Okay. You're looking at a section through the thyroid, through the larynx. Okay. You're looking at a section through the larynx. These two are the arytenoid cartilages. This is the lateral surface of the arytenoid cartilage. This is the vocal process of arytenoid cartilage. Don't become upset that I'm not understanding this because we've not covered arytenoid cartilage. Sometimes you have to move forward accepting that arytenoid cartilage has a vocal process and it has an anterolateral surface. This is one arytenoid, this is the other. Extending from in front here on both sides are the 2 laminae of thyroid cartilage. This we understand. And extending from the vocal process to the thyroid cartilage on both sides are ligaments called vocal ligaments. I want you to just imagine these 2 fingers of yours extending posteriorly to the arytenoid and anteriorly getting attached to the thyroid cartilage. On the side of vocal ligament, you will find vocalis. See how it's attached lateral to the vocal ligament, and thyroarytenoid further lateral to it. So from medial to lateral, you will have vocal ligament, vocalis, thyroarytenoideus. Vocal ligament, vocalis, thyroarytenoideus attached here. Why are we studying this? What is the origin of vocalis? What is its insertion? Origin, vocal process. Insertion, thyroid cartilage, posterior surface. Origin of thyroarytenoideus, anterolateral surface of arytenoid cartilage. Insertion, thyroid lamina. Posterior surface of lamina of thyroid cartilage. This much we can see from the diagram and we can understand. Okay, but what is the action and why are these muscles there? That's the question. So understand that your vocalis muscle is variably attached to the vocal ligament. Remember, vocal ligament is the tuning fork that's going to make the sound. So vocalis is variably able to tense and relax your vocal ligament. Okay, it's able to cause tension as well as cause thickening of the vocal cords. This helps to regulate the pitch of your voice, the tone of your voice, and the volume of the voice. Meanwhile, what is thyroarytenoideus doing? Thyroarytenoideus is basically contracting to pull the thyroid cartilage to the arytenoid, relaxing the vocal cords. So, cricothyroid was tensing the vocal cords. Thyroarytenoideus was relaxing the vocal cords, and vocalis was variably relaxing and tensing the vocal cords. Okay? So thyroarytenoideus helps to reduce the pitch, helps you when you want to speak in a softer voice. It's thyroarytenoideus which is going to come into play. So what did we understand? We understood that cricothyroid stretches the vocal ligament. We understood that vocalis and thyroarytenoideus relax the vocal ligament. Vocalis has variable relaxation. Thyroarytenoideus just plain relaxes the vocal ligament. Between these three muscles, they are able to enable speech, singing, and other vocalizations by variably changing the thickness, the tenseness of your vocal cords. Isn't it amazing? These three muscles, they are tiny. If you dissect the larynx, you will find that they're so tiny. It really takes a really good dissector to be able to dissect these muscles. And they control your voice. They control the tone of your voice, the slight inflections in your voice, the rising volume, and the softening of your voice. Isn't it amazing? I find it beautiful. So if you're liking my lectures, do like and subscribe to my channel. So we've completed the upper border, lower border, and anterior border of the thyroid cartilage. What is left to study? The posterior border. This posterior border, okay? This posterior border gives attachment to three muscles: palatopharyngeus, salpingopharyngeus, stylopharyngeus. If you've studied pharynx, then you know that these are longitudinal muscles of pharynx. Every time you swallow, they help to lift up your larynx up and down. Okay, these are the longitudinal muscles of pharynx. So you can see this is the superior horn and this is the inferior horn. You know superior horn is attached to hyoid bone with the help of lateral thyroid ligament. You know the inferior horn here articulates with the cricoid cartilage to form a synovial joint. A joint between the two cartilages is the very reason why your thyroid cartilage can tilt forward and back, forwards and back when cricothyroid acts. Please use this, okay? Imagine that your thyroid cartilage is anchored to cricoid here and then allow your thyroid cartilage to fall forward, backward. When it falls forward, tenseness of vocal ligament. When it goes back by thyroarytenoids, relaxation of a vocal ligament. You have to do all this to really understand. This is the oblique line which gives attachment to three muscles. Sternothyroid from below, thyrohyoid passing up, and from the pharynx, the inferior constrictor. Between the sternothyroid and inferior constrictor, if you can see, here is the thyroid gland, which gets sandwiched between these two muscles, rising halfway to the thyroid cartilage. Okay? Can you name this muscle, please? Yes, I like to ask questions. Come on. What is this muscle going from cricoid to thyroid? Cricothyroid. This bone? Hyoid bone. This membrane? Thyrohyoid. From thyro to hyoid. Thyrohyoid. So, in the thyroid cartilage, you learnt details of cricothyroid, vocalis, thyroarytenoideus, how they tense and relax the vocal cord and ligament to help you create various kinds of sounds. You also touched upon longitudinal muscles of pharynx and other muscles attached to the thyroid from outside. Remember, while these are intrinsic muscles, these are extrinsic muscles which also have their own influence on larynx. I hope you studied understood, and will revise before you come for the next class. Bye.